95 AM, 8223 0000, the interactive number. This is the Health Hour on 5AA with Dr. Kate Howe. Our guest on the program at the moment is Warren Maginn, a clinical nutritionist and spokesperson for Nordic Naturals, talking about the benefits of omega-3 fatty acids. And Warren, Dr. Kate has some more questions for you. I'll allow her to get on with them.
No worries.
Sure.
I just wondered if we could go back to basics, Warren, and, you know, I think the listeners may sense this. You know, there's some confusion around fats. You know, back in the late 70s, you know, Australia said, right, fats are bad for your heart. You know, everyone's going low fat, try and avoid fats. And there was that big push for cardiovascular health. And so I think we've adopted an approach where blanket, you know, fats are bad. Can you talk about that, perhaps to debunk some of that thinking?
Absolutely. Thank you for asking that, because
Yes.
I really find that is one of the major scourges, for want of a better word, in nutritional science today. I think we're still living in the remnants of that logic that it clearly doesn't apply when we look at the science. And as a nutritionist, I don't see that bear true in terms of the outcomes from dietary change. So both anecdotally and very rigorously in the research, I can confidently say that fat is a fantastic and necessary component of a healthy diet. We've perhaps demonized fat by not being able to distinguish the good from the bad. But I do have to say that a lack of fat in general is as bad, if not worse, than any of the bad fats. And that may sound like a strong statement to make, but when you think of how much of our body form and function is actually made from fat, you can see how important it is that we access those fats. So
and people often don't realise, do they, that, you know, each cell wall has fat in it.
Correct.
You know, we need fat for our metabolism. We need it for every part of the body.
That's right. I mean, one of the things I sometimes discuss with my patients is that oil and water doesn't mix. We all see the vinaigrette on the counter separate if it's sitting there too long. We also know that we are water-based life, and that in ideal circumstances we're around 60% or more water. We need fat to separate all those compartments of our very complex body, and that really is each and every cell is a fat-built structure. And so the fats we acquire in our diet really are going to be a key aspect of the old saying, you are what you eat. You are definitely built by fat. There are a lot of fats we can make from carbohydrates, and ironically, they're the kind of fats we don't want most of the time. They're the ones that sometimes present a cardiovascular disease risk, or they stick to the hips, you know, much to a lot of people's frustration. So things like omega-3s are a very, very different type of fat. They are essential to healthy brain function and cardiovascular function, and almost every system in the body benefits from having those in our cell membranes. And we barely use them at all for energy. The body would much prefer to use other sources of calories than omega-3s, so we've really got no risk of taking on too many calories through omega-3s. So really any of the concerns around taking something like fish oil are not justified, but I guess you're raising the point that other fats are also helpful, and we should also include them in the diet.
So,
and I think that makes a good point of how to absorb your fish oil. I think something I make clear with my patients is to always make sure they take a little bit of fat in their meals, not to be afraid of fat, and to take the fish oil with a meal that has fat in it, because they'll all work together and be digested efficiently and metabolized harmoniously, and that's going to be one of the best things you can do for, let's say, blood sugar levels and other aspects of health.
And I think what happened too when the move was to have low fat, what crept into our processed foods was sugar, but also trans fatty acids. Unhealthy fat. So what's a simple way of explaining to people, you know, apart from the omega-3s in their daily intake, what sort of fat should they be having and what should they not be having?
Right. Okay. Well, the two classes of fats we do want to avoid, the first would be the ones you just mentioned there, the very refined and trans fats. Anything that's oxidized is going to be a big no-no to your body, because we already have a lot of oxidative stress in modern life. We don't need more. And so anything that's been fried or excessively processed can potentially be oxidized or in the trans form. Now, the problem with trans fats, if people have done some reading on this, is not just that they don't necessarily have a useful function to the body, but they tend to gunk up the body as well. They congest the liver and stop the body being able to use the good fats when they come along. So, for example, you might be diligent enough to take a good fish oil, but you're still consuming trans fats. Those trans fats will be sabotaging your ability to make the best use of those omega-3s in your fish oil. So you definitely want to get trans fats out of the diet. Mm-hmm. But the next class of oils is the omega-6s. Now, in nutritional science, we learn that they are technically essential, and that is true. But in the modern diet, we have such a preponderance of omega-6. It's so abundant in almost everything we eat. It would be almost impossible to be deficient in omega-6 if you're eating a sufficient caloric diet in the modern world. So I would encourage people to actually avoid all the sources of omega-6 that they can practically. And that really means those clear yellow oils in the clear plastic bottles at the supermarket. They tend to be, when you're frying things, they sometimes get advertised as a positive thing for your health by being low in cholesterol, and that would be a separate topic, but we obviously now know in the literature that cholesterol in the diet doesn't necessarily correlate with the cholesterol in our blood. And adopting these omega-6 oils is actually giving us an inflammatory burden, because what our body loves to do it with these omega-6s is make inflammatory compounds, and inflammation is a major feature of most chronic modern disease. So the reason we're taking all this omega-3 is to try and outpunch all this omega-6. So you can really add a lot of weight to your fish oil. You can basically get more bang for your buck if you can also avoid omega-6s where practical.
It's 29 minutes after 8 here on Adelaide's 5AA. Warren Maginn is the person who you're listening to at the moment. He's a guest with Dr. Kate Howell on the 5AA Health Hour. And Warren, a clinical nutritionist and also spokesperson for Nordic Naturals, talking about the benefits of omega-3 oils. Melissa is on the line with a question. Hello, Melissa.
Yes, hello. Look, I'm totally confused. As I understand it, cholesterol, which is a fatty substance, is an essential part of the body and our well-being. I don't really know where to go because I know my body needs cholesterol. The liver, as I understand it, produces cholesterol. But at the same time, I'm told that I should not me personally, but I'm, listening to all this, I'm told I should reduce X, Y, and Z. Look, can't we have some clarification? The body needs cholesterol, but the brain, the heart, everything needs cholesterol. And yet, somehow we're being told we shouldn't be eating fat. And yet, fat's not too bad.
Warren, do you want to comment on that?
Yeah, absolutely. Thanks for bringing that up. I think that's absolutely valid. Everything you've just said is absolutely correct. And, if you have done a lot of research to come to that conclusion, then, congratulations. But if you've used sound logic, I also congratulate you, because we really do need to scrutinize some of the conclusions we currently hold, but really we just ran with very little scientific consensus on them originally in terms of the actual evidence rather than political sway, I should say. So without sidelining this discussion, we were really focusing on depression. And so if I was to step aside from the cardiovascular debate and just point out to what you just highlighted, that cholesterol is also important for the brain. It's very necessary as a cell membrane stabilizer, so omega-3s are important, but cholesterol is too. And I think we've perhaps incorrectly demonized cholesterol by having seen it accumulate in plaques in the arteries, and I think cholesterol is only guilty by being seen at the crime. It's not necessarily cholesterol that's the problem, it's what's happening to the cholesterol that is the problem, and one of the main problems of what happens to cholesterol is oxidation and inflammation. And that's why something like omega-3 with healthy cholesterol levels is one of your best health insurances from a number of chronic disease risks. And we actually see that in the literature that people with excessively low cholesterol, or I should say insufficient cholesterol levels, actually have a worse long-term health prognosis than those with moderate to moderately high. All things being considered, obviously inflammation and oxidation are being considered. So yes, cholesterol we definitely need to put back on the table. We definitely need to think of foods that have cholesterol as healthy foods. And if we find someone's cholesterol level is skyrocketing, we really do want to ask more questions about the carbohydrates they're eating, the inflammation in their body, and the health of the liver, which is what makes up to 90% of the cholesterol you find in the blood anyway. And that's really where we should perhaps cast our focus rather than demonizing otherwise healthy foods.
Melissa, thanks very much for your call and your question for Warren. Now, Warren, where can people find, you're talking about the literature surrounding all the information on these omega-3s and your product in particular, the organisation that you're representing, Nordic Naturals. Where can people find out more? Can they read more about Nordic Naturals and omega-3 fatty acids, or fatty oils rather?
Sure. Well, if anyone is research-minded, they can do a very simple Google search on PubMed to look at studies on omega-3s, and you'll see there are thousands and thousands. Omega-3s and fish oil is actually the most researched nutritional supplement on the planet today. So there's no shortage of research if somebody wants to get into it. Otherwise, as you mentioned, Nordic Naturals is a fantastic range of fish oils that I came across clinically, and I obviously speak on their behalf because I found such great clinical effects. All the things I was led to believe I should expect from an omega-3 supplement finally came true when I was using a quality product. And I was surprised to find there are very few quality products out there. So Nordic Naturals is just one that I found. And if somebody wants to read about those, they could obviously look on the Nordic Naturals website. If you did any Google searching on Nordic Naturals as a brand, I definitely vouch for those. But otherwise, as I said, I would rather rest on the evidence of the literature, and a lot of Nordic Naturals products are actually what are tested when they look at studies. And somebody who wanted to look at those very focused studies could go to a website called omegaresearch.com and see a lot of those very focused studies to show them more about these health benefits we're talking about if they were to get lost otherwise in the other great world that Google might present to them.
Warren Maginn, thank you very much for your time tonight. Appreciate it.
You're welcome very much. Thank you.
Thank you.
And Warren, a clinical nutritionist and spokesperson for Nordic Naturals.